Ever wondered about the most dangerous chemicals that lurk within the confines of a laboratory? Today, we venture into the world of scientific perils, shedding light on 10 of the most hazardous chemicals one might encounter, their dangers, and how to mitigate these risks. First on our list is hydrofluoric acid, or HF. This sinister substance can cause severe burns, destroy tissue, and even penetrate the skin to react with the calcium in your bones. If exposed, your immediate response should be to flush the area with water, apply calcium gluconate gel to neutralize the acid, and seek medical attention without delay. Next up is chlorine gas, denoted as Cl2. Exposure to this gas can lead to respiratory irritation, coughing, shortness of breath, and even pulmonary edema at high concentrations. If you cross paths with this gas, evacuate the area, seek fresh air, and get medical help. Always remember to wear respiratory protection when working with chlorine. Then comes mercury, known to chemists as Hg. This chemical can cause neurotoxicity, kidney damage, and can even be absorbed through the skin. The vapor form of mercury is particularly hazardous. To counteract exposure, avoid skin contact and inhalation of vapors. If a spill occurs, use the correct absorbent material and dispose of it appropriately. Hydrogen cyanide, or HCN, is our fourth entrant. This highly toxic gas interferes with cellular respiration, leading to rapid unconsciousness and even death. In case of exposure, evacuate, provide fresh air, and use cyanide antidote kits if available. Seek medical assistance immediately. Fifth on our list is sodium azide, represented as NaN3. This highly toxic compound releases a toxic gas, hydrozoic acid, upon contact with acids or metal surfaces. To prevent harm, steer clear of acids or metals, and if exposure occurs, remove contaminated clothing, wash the affected areas with water, and seek medical attention promptly. Next, we have sulfuric acid, or H2SO4. This acid is corrosive to skin, eyes, and the respiratory tract, and it can cause severe burns upon contact. If an unfortunate encounter occurs, immediately flush the affected areas with water for at least 15 minutes, remove contaminated clothing, and seek medical help for serious burns. Seventh in line is sodium cyanide, denoted as NaCN. This compound is highly toxic and inhibits cellular respiration, leading to rapid unconsciousness and death. To counteract exposure, avoid inhalation and skin contact. If exposure does occur, use cyanide antidote kits if available and seek medical assistance immediately. Our eighth contender is phosgene, or COCl2. This highly toxic gas can cause respiratory distress, lung damage, and pulmonary edema. If you come into contact with phosgene, evacuate the area, seek fresh air, and get medical treatment for respiratory distress. Always wear appropriate respiratory protection when working with phosgene. Next up is perchloric acid, denoted as HClO4. This acid is corrosive to skin, eyes, and the respiratory tract, and it forms explosive compounds when in contact with organic materials. To protect yourself, handle with care, avoid contact with organic materials, and if exposure occurs, immediately flush the affected areas with water and seek medical attention. Last, but certainly not least, we have potassium cyanide, or KCN. This highly toxic compound inhibits cellular respiration, leading to rapid unconsciousness and death. To mitigate the risks, avoid inhalation and skin contact. If exposed, administer cyanide antidote kits if available and seek medical assistance immediately. Remember, these countermeasures are general guidelines. Always consult material safety data sheets or safety data sheets for specific handling and emergency procedures for each chemical. Moreover, never forget to wear appropriate personal protective equipment such as gloves, goggles, and respirators when handling any hazardous chemicals. Stay curious, stay educated, and most importantly, stay safe.